I'm Dr. Siri and I'm today here to talk about mucormycosis. So mucormycosis disease is the talk of the heart since it is seen as a complication along with the COVID-19 disease. So let's see about what is this disease, how it is caused, what are the predisposing conditions, what are the symptoms and how to prevent it. So mucormycosis is a fungal disease caused by a group of fungi known as Mucormycosis, and they are particularly seen in soil and in decaying organic matter such as leaves, compost and also in cow dung. But it is in general present throughout the environment but most commonly seen in soil. So they are very microscopic in appearance, so we cannot see with the naked eyes. And these fungi aren't harmful to most of the people, and they become harmful to people who are immunocompromised or immunosuppressed, and it causes breathing difficulty and other infections. So basically, it is not harmful, but it causes harm to people who are immunocompromised. So let's see what are the conditions that predisposes to occurrence of mucormycosis. So conditions like uncontrolled diabetes mellitus, immunosuppression by steroids. Steroids are a group of drugs. So when such drugs are taken and the immune system is depressed, that is the opportunistic condition for this fungi to attack the human body and cause the disease. Then prolonged ICU stay, that is prolonged stay in the hospitals. So where the immune system comes down due to the prolonged stay and hospital-related infections and all occur. So in such cases, then comorbidities such as post-transplant, that is after any organ transplant or any such kind of medical procedures, or in cases like malignancy. So in these conditions, people are more prone to encounter mucormycosis, and there is a group of drugs called voriconazole. So voriconazole therapy for a prolonged duration. So these are all the predisposing conditions for the occurrence of mucormycosis. So when to suspect that a person can be having mucormycosis? That is, if the person has sinusitis, that is nasal blockade or congestion, nasal discharge that can be blackish or bloody appearance, or local pain or there can be pain in the cheekbone region. Then there can be one-sided facial pain, numbness or swelling, and blackish discoloration over bridge of the nose, that is in this area, and the palate, that is the inside surface of the mouth, the upper surface of the mouth, that is the palate. Then there can be toothache, loosening of the teeth, and there can be any involvement of the jaws, and there can be blurred or double vision with fever, and there can also be skin lesions. Then there can be chest pain or worsening of respiratory symptoms, that is difficulty in breathing. So these are all the warning signs, like these are all the situations where you can suspect that the patient is going towards having mucormycosis. That is now in currently talking about how it is associated with COVID-19. So after the recovery, if these symptoms comes up, it can be suggestive that there can be occurrence of mucormycosis. Then what are the do's? Like what are you supposed to do when you encounter such conditions? So basically, initially it is very important to have a controlled blood pressure, that is control of the hyperglycemic situation. Then it is very important to monitor the blood glucose level post COVID-19 discharge and also in diabetics. So after the discharge, after the recovery from COVID-19, as per thorough monitoring is very necessary. That is to have a check on the blood glucose level and to have controlled blood pressure. This hyperglycemic patients should be aware about this. Then if there is been suggestion to use the steroids, so the use of steroid therapy should be done in correct timing, correct dose and correct duration. When using of clean sterile water for humidifiers during oxygen therapy, use of antibiotics or antifungals, maybe any medicines, it should be used only when it is needed, that is judicious use of the medications. And now there can be one more doubt in all, that is mucormycosis contagious? No, mucormycosis can't spread between people and from people to animal or animal to people. So let's see the symptoms. So let's see basically about symptoms of rhinocerebral, that is sinus and brain mucormycosis, and symptoms of lung, that is pulmonary mucormycosis. So when it comes to brain or sinus related, the symptoms can be one-sided facial swelling, headache, nasal or sinus congestion, black lesions or on nasal bridge, and there can be blackish discharge or bloody discharge, and then there can be fever. So these are the basic typical signs and symptoms of brain-related mucormycosis. So in terms to lungs, like when the lungs are involved due to mucormycosis, the symptoms can be like fever, cough, chest pain, shortness of breath, difficulty in breathing. So these are all the symptoms. So what are the don'ts? Like what are you not supposed to do when you encounter such situation? So the first and foremost thing is not to miss on any warning signs and symptoms. So I've already discussed about the signs and symptoms. So if you get any of these signs, it shouldn't be neglected, but it is not necessary to panic as well. But it is very important to talk to your doctor or the family doctor or the physician and convey the signs and symptoms. So we have to never miss the warning signs and symptoms of mucormycosis. And do not consider all the cases with blocked nose or any bacterial sinusitis. That is, like at times you might have blocked nose, sinusitis. So it should not be confused and thought that it is mucormycosis, and it is not to be not to go into a state of panic. Then in context of immunosuppressive and COVID-19 patients who are on immunomodulators, so they all have to be very careful. Then do not hesitate to seek aggressive investigation. Suppose the physician tells you to undergo any investigation, you should not hesitate to undergo this investigation as appropriate, and do not lose crucial time to initiate the treatment. So it is very important not to lose the time to initiate the treatment who are already diagnosed with mucormycosis. So the action should be as early as possible once the mucormycosis has been diagnosed. In the early stages, mucormycosis can be treated and the patients can get cured, but in later stages it becomes very critical to cure the patient and it can be fatal. That is, it can lead to death of the patient. So that is what, as I told, mucormycosis, if it is uncared, it can turn fatal. Like mucormycosis, as I already told, is a fungal infection, and it mainly affects people who are immunocompromised, who are on medications. So the best way to prevent is using of the masks and thorough cleanliness, that is thorough cleaning of the masks after we get back to our respective homes. So it is very important to keep the hygiene of ourselves as well as the masks that we use. Then it is very important to wear shoes or long trousers or long sleeve shirts and gloves while handling soil, that is during gardening, moss or manure, like the persons who have been recovered from COVID-19 and if they are immunocompromised, if they have any comorbidities. So it is very important that we take all the necessary precautions. Then also, it need be said, it is very important to have a personal hygiene, including thorough scrub bath once we go out and come. So these are all the details about mucormycosis, that is how it is caused, what are the warning signs and symptoms, what are we supposed to do, what are we not supposed to do, and how are we supposed to address it, and how do we take care of ourselves. Thank you.